Hi, this is Divya, Assistant Professor, Biomedical Engineering Department in SNS College of Technology. In this video, we are going to see about the continuation of the previous video where the medical monitoring of a patient in a chronic disease is continuing. Here we can see that the remote patient monitoring. Remote patient monitoring is that wherever place we have where the patient is present, we can identify, we can monitor the patient there by there. Okay. That is RPM, which means the remote patient monitoring uses wearable sensors and digital devices to continuously collect healthcare data outside clinical settings. Okay, revolutionizing how we can manage chronic conditions. Okay, we use wearable sensors and digital devices to continuously monitor healthcare data outside clinical settings. Clinical settings is that we'll go into a clinical system, that is a hospital or likewise, and from there we'll be identifying what all the parameters to be identified and we'll be noting that. Whereas in this remote patient monitoring, right, we'll be having a device where it contains the wearable sensors and the digital. It is a digital device. Okay, where we can find the data that will be incorporated in that data itself. See, in this image we can see that we have posted the smartwatch, right? Nowadays the smartwatch will be having a settings that where we can find the heart rate, blood pressure, stress or something like that. We can identify all the parameters, vital parameters, oxygen level, glucose level, even though. Now in the smartwatches itself, likewise we can use these smartwatches to the patients and we can monitor how the patient is, whether they are stable or not. Okay, common RPM devices. What are the common the one example what I told is the smartwatch. Another thing, what are the common devices we have is that blood glucose meter for diabetes management, blood glucose meter for I generally told the smartwatches contains these vital parameters can be identified. We have a specific meters also to identify specific thing. Blood glucose meter for diabetic management. For identifying the diabetics, you can use blood glucose meter in the device. Blood pressure monitoring for hypertension tracking. For blood glucose is for diabetics, blood pressure is for hypertension, and pulse oximeter is for respiratory disease monitoring. Okay, these three are the main devices which is incorporated in which can be incorporated to a single device, or else it can have the three different devices also. Data is automatically transmitted to healthcare teams for real time or asynchronous reviews, enabling proactive care. By using these three meters, we can identify the data with whether the glucose level is low, pressure is high or something like that, and that will be immediately transformed to that real time data. Regular data can be taken and we can act accordingly by giving medicines to them. Okay, next is how this remote patient monitoring improves patients' outcome and experiences. Okay, real world data demonstrates the transformative impact of remote patient monitoring programs on both clinical outcomes and cost efficiency also. 230%, that is therapy adherence, increases in patients achieving guidelines directly therapy adherence in heart failure management. Okay, 230% we can identify the therapies has been given for the heart failure managements. This has been a very huge process, huge appreciation for this, because by using these remote patient monitoring systems, it will be very helpful in analyzing the patients and treating them in remote way. Next, 52% the cost reduction has been done. Okay, according to the regular way, that is, since the patient's going for an hospital for a weekly, a daily basis like that, the cost will be more in all the bases, right? The traveling time, the traveling cost, the patient waiting time, and all the full day gets affected, and even the patient gets stressed also. Once we are using these remote patient monitoring systems now, the 52% of the cost reduction can be done. Decrease in total cost of care for heart failure patients enrolled in RPM programs. 52% of a cost reduction for specifically for heart failure patients has been reduced. Okay, 97% of patient satisfaction, that is the main thing where we have, right? 97%, nearly to the 100% of the patient satisfaction has been done by using these remote patient monitoring system. Once this system has been incorporated to the patient, and when the patient is fully educated about the component, that will be very helpful for the patient to understand what is health is happening, how it is happening, what is happening, and what he needed, and all those steps. Okay, patient satisfaction of patients report feeling more connected and supported by their healthcare providers. These healthcare providers will be connecting to these systems, and they'll be frequently seeing all the data, how they are acting, how the patient is, and the regular basis the checkup or the monitoring can be done, and it helpful for the patient in a very huge manner. Okay, thank you.